Welcome back to Body Beautiful. I'm Janelle Marie. I am here with Dr. Joseph Mele, and we are talking plastic surgery. All right, so let's tell everybody what blepharoplasty is, Dr. Mele.
So blepharoplasty is eyelid lift.
Oh.
So blepharo relates to the eyelid. Plasty means to change.
Okay.
So usually on the upper lid, we're getting rid of extra skin.
Yes.
And sometimes we'll have a little bit of extra fat towards the middle part of the upper eyelid, and we'll take a little bit out of there too. But you don't want to take too much fat, especially from the upper eyelid, because you don't want to make it hollow and skeletonize it and enhance the age. You want to make it look younger. For the lower lids, usually there's extra fat. So there we don't get a lot of extra skin. So we're usually decompressing that, trying to smooth it out.
Do you do a little, can you do a little liposuction? You can't really liposuck under the eye.
No, it's a little dangerous to do liposuction there. I mean, one of the complications of surgery is bleeding. And with blepharoplasty, everything's open. So if it's open, you can see where it's bleeding, stop it in the operating room. If you're rooting around with the liposuction,
that's not going to be good.
That wouldn't be a good idea.
Pictures, doctor. First one. Oh, that's us. There we go.
So here's an idea of a blepharoplasty. So both upper and lower eyelids. The upper eyelid, you can see the skin's resting on the lashes.
Yes.
And that's usually when people notice, because they'll feel heaviness. It will run down and grab your eyelid makeup and pull it out of the way so it won't stay.
That's not good.
So afterwards it stays. We can see the nice rim of the eyelid.
Gorgeous.
And the lower lid, we get rid of that bagginess, the fullness.
And it really wakes you up. You look not tired anymore.
Yeah, the goal is people look awake.
Exactly, I like that.
And when our eyelids get heavy, we look tired.
Yeah.
And we want to look refreshed. We want to look alert, like we're paying attention.
Let's go to photo number 2. Also, talk about scarring on that, like what happens when you...
Sure. So this is relatively early after surgery. So the scar runs right underneath the eyelid there. And you can see the fullness, that bagginess of the upper eyelid now is gone.
Yes.
And it's all smoothed out. The incision actually runs along the lower eyelid and down to the side a little bit. So it goes down and out from the eye. That allows me to take out a little triangle of skin and pull that lower lid skin tight across the lid. Wow. It avoids pulling the lid tight downwards and giving that hound dog look. So if you take out too much skin, that's the problem.
Let's go to picture 3.
And same idea here. So her eyes look much more open and alert. She can wear eyeliner now without it moving around. And that upper eyelid, very heavy. Now she has a lot of extra fat in that upper eyelid. That's not bad.
No.
It's actually very youthful, so I don't want to take it all away. I want to remove enough, though, that the eyelid skin will retract and come up so we can see the eyelashes.
That looks amazing. And we have one more picture, I believe. There it is.
And
you can really see the heaviness,
Someone with very heavy upper eyelids resting on the eyelashes. Asian eyelids don't have the same attachments as the Occidental eyelid, so the fold for you and me is about 9-10 millimeters up. In the Asian eyelid, it's more like 4 to 6 millimeters, very low. And because we don't have that barrier, the fat tends to fall down and push the eyelid down. So we get a very smooth upper eyelid. So a lot of times we're trying to correct it and make a little curve in that upper eyelid.
All right, so you see a lot of people, coming in that maybe it hurts their vision a little bit.
It can, and if it hurts the vision, sometimes insurance will actually help pay for it. But usually they'll want you to see an ophthalmologist, get the peripheral vision test. Most commonly it'll affect side vision and the upper.
Thank you so much for joining us. If you need more information about Dr. Mele, you can give him a call, 925-943-6353, or check him out, drmele.com, or you can go to sanfranciscobreast.com. That was great information. Thank you for joining us today, you viewers, and thank you, Dr. Joseph Mele. That was terrific, and I'm going to say it one more time, blepharoplasty.
Perfect.
Have a great day, everybody. Bye-bye. Thank you.
Thanks.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.